CU Medicine Geriatric Medicine Cherry Creek is now taking appointments from all members of the community 75 and older. Previously, the clinic only served Kavod Senior Life residents. I'm with CU Medicine physician Dr. Jeffrey Wallace to talk about the services the clinic provides. So for seniors or those with loved ones 75 and over, what is offered at CU Medicine Geriatric Medicine Cherry Creek? Why would someone come see you?
I like to think of geriatric medicine as good medical care, kind of what your internist or family medicine provider does, with a plus. And the plus is we have additional training, focus, and resources to help older adults. In particular, it's not a straight, the patient who will benefit most is a patient who has really complicated multiple medical problems, maybe some social stressors, maybe some cognitive or mood problems. And the providers really need to have the time and to some degree to the training to really kind of sort out the complicated medical and psychosocial issues that older adults often face.
What are some common health issues that you treat in geriatric patients?
Among the most common are patients who have problems with balance and falls and concerns about getting fractures. And if they haven't had fractures, osteoporosis prevention or treatment. Certainly memory and mood problems are very common and increase, the memory problems increase with age. Thankfully, the mood problems don't increase that much with aging, but still are a common problem when you have lots of challenges medically and otherwise. Other typical geriatric syndromes are bladder and bowel continence challenges, polypharmacy, too many medications and trying to sort out which medications really are critical and which perhaps can be dispensed with, and nutrition and activity. Those would be kind of classic things that we would look to intervene on, understand, and be well trained to take care of.
And one of your interests is depression and cognitive impairment in older adults, health issues like dementia, Alzheimer's. What increases someone's risk of developing dementia?
So unfortunately, the biggest risk factor is what we all want to do, which is growing older. As we age, our risk of getting cognitive difficulties starts doubling at about age 60 to 65. Now, it starts at a low number, about 1% of people at age 60 to 65. But about every 5 years, that number doubles. And as you get into your 80s and 90s, the risks really become above 20 and even 30% when you're in your 90s. We all want to, of course, avoid being in that challenging cognitive decline category. And so the main things one can really have control over is physical activity is probably first. Inactivity, lack of exercise has been shown to be associated with increased cognitive difficulties. And more importantly, studies that get people walking or doing some even light weight training a couple times a week have shown to positively impact the brain and cognitive function. There's been some more recent studies that better control of blood pressure can help protect the brain and probably, but not definitively yet, decrease the risk of getting Alzheimer's disease or other types of dementia. Interestingly enough, hearing seems to be a big factor as well. There's something about our brain wanting to get sensory input, and when that fades from hearing difficulties, that probably increases the risk of neurologic decline and memory problems.
But you mentioned exercise. Is it also just exercising your brain? You see all those apps and things out there about, answer these quizzes every day, keep your brain in shape. Do those really prove to help at all with something like that?
There's been a lot of studies done with brain exercise, specifically the websites that you can sign up for that put you through various tasks. And actually, they really don't look like they prevent cognitive decline. They can help your brain be a little sharper. So the issue would be, well, if I did some exercises to help me strategize in certain ways or focus a little better, that may help for a while. But unfortunately, if you had the genetics or other predispositions that are going to have you have memory problems, down the road, these short-term brain exercises really don't seem to stave it off. It doesn't seem to make the neurons healthier. Whereas physical exercise, there's studies that taking a walk 30 minutes, 5 days a week, that was one particular study intervention, really made the brain area that has memory control larger on MRI scans. And test of cognitive function stayed higher than for the people who sat on the couch for a year's worth of follow-up. A bright colleague once said, best thing to do is read a book or do brain puzzles while you're on your exercise bike.
What are some ways that families can support older members of their family?
I really think that the biggest goal of the family is also to keep the patient independent, right? That means physically independent to start, being able to get up, get out, whether it's driving or if they don't drive anymore, to be able to take transport, go do the things they want to do. And so honestly, I think a family member really just needs to look at the situation and say, is there anything I can do to help kind of mobilize my family, keep them engaged, keep them connected, but it's not taking over for them. I really think I like when family members come in with patients to appointments. They get a better understanding of their loved one's health and other challenges they may be facing. But I don't really want them to take over. The patients don't want them to take over either, unless there's a clear cognitive difficulty that the patient needs assistance. The loved ones are there to support the family, connect them to the community, connect them to the family, get them out of the house, as hopefully COVID is now allowing us to do a little more. But it's really all about support.